share your video today. We are going to be doing some of the facial filler today, and you certainly know the power of smile. You've got a great appearance. Now, can we share how young you are? You don't have to say if you don't want to. It's going to be a surprise.
Okay, surprise it.
No, so we're not going to mention, that's fine. But what we are going to do today is we talked about some of the filler. Through these areas, we're going to use the Sculptra, and we're using some of the Radiesse. So hold this for me, because I'm going to mark with my little white pencil. And so these are the areas that we talked about. With the Sculptra, which is a superior collagen stimulator, we're going to build in these areas. And then with the Radiesse, did you want to build around a little bit in the smile lines? Did you have a preference?
As long as it doesn't make my lips.
No, we're not going to make the lips too much, that's for sure. And so we talked about, we're going to use some of the Botox Dysport Xeomin, and that was for across the top and some of the crow's feet, is that correct?
Correct.
So we're across through here. With the crow's feet, there's two types of crow's feet that we get. There's the suspicious lines that we get when we flex a little bit, and those will soften in the brow or lip. When you go big and smile like this, you can't stop the crow's feet because there's too many muscles that are recruited, and then we'll come across through the forehead. Now, you had mentioned in the past when you have the Botox at a different place that the brow is different position.
Yes.
So that's not going to happen today, but I tell all my patients, at 2 weeks, if you're not happy, you think you need a little adjustment, come in, but you got to give it that 2 weeks for things to settle in. But anytime if you have Botox, if a brow's a different position, you should definitely come back in for another unit or two and get that addressed. So we're going to treat these areas across through here, and then now we have the Radiesse and the Sculptra. So for those, I wouldn't treat across the fine lines. I would just be treating in through here. If you, at some point, if you want to treat the fine lines, there's a fine line filler I use or laser. But with Radiesse and the Sculptra today, what I would do is, it's very normal that we'll start to hollow a little bit around the eye. I do a little in the brow, a little in through this area, the smile lines through here, and I'm debating on whether or not, sometimes I'll put some in the back of the jawline, but let's focus up front here, and then if you decide you want more in other places, I'll show you as we go along. Okay. How does that sound?
Sounds good.
Okay, did you tell your friends?
But can we do a little bit of the fine line filler?
So here's how that's a very good question. So right now we have the Radiesse and the Sculptra. I can add a fine line filler if you want to. That would be a different product, and I use hyaluronic acid for that. Now I could, if you want, we can change your Radiesse syringe to a fine line filler product and do that instead. But we would have to decide, because Radiesse is calcium based, and we don't want to use that in the lip because it's white and it would show. Do you want to trade that Radiesse and treat some of the fine creases that way? How do you feel about that?
I think you're probably the one to tell me what's the best option that I should do.
If you want to treat those fine creases, I'll have them just get one of my syringes of Versa, and we can do that, but we don't want to do any lip plumping, is that correct?
Correct.
Or let me see if they just get one of the Restylane would be fine. Restylane. Can I get one syringe of Restylane for room 1, please? Thank you.
What am I trading out?
That would be the Radiesse syringe.
But what effect?
Radiesse, I use mostly to fill out in these areas. And this is a very good discussion, because people say, well, if I change the product, how is that going to impact my overall results? So this is a very good question. If I use Radiesse is a good bulk filler. It's a good filler for beginners to get a feel what you like, and when you come back, if you're happy, we had this discussion, then people want to do longer term permanent fillers. So Radiesse will give more correction in these areas, but Radiesse really, you don't want to use that in the lip. But with the fine line filler, I can treat some of these creases a little bit better in the corner of the mouth, and I can plump the lips, but you didn't want to do any plumping, so we'll leave the lip plumping.
The plumping business is, it's that I'm afraid, because I've seen people with lips that have been, that you can tell that are not normal lips, and I don't want to look like that.
So you'll definitely look very normal from what we do. So the answer is, if you want a little plump that's going to look normal, we do some plumping. If you say, you know what, don't do any plumping at all, then I'll just treat the fine lines. So how do you feel about the two options? Fine lines only, or treat the fine lines and a little bit of lip plumping? Your family and friends won't figure out what you did. What do you feel?
Okay, if they can't see that my lips are...
They won't figure it out, and it won't look like the fish lips.
And what about this line?
So that line, which we talked about, now we had the discussion that ultimately a little tightening, because you had one of those radio frequency treatments in the past. She was not happy with the results. So you really have to be careful when it comes to radio frequency that it really addresses what you're looking for. So really this requires a tightening and a little bit of fill. So what I can do with the fine line filler is I can just plump in through this area as best I can. I'll treat the fine lines, a little plumping, and then I'm going to focus on the corners of the mouth.
Perfect.
And then what I have left we can address up here would be the last priority, okay?
Okay. Sounds good.
Okay, so if you could set this one aside for me, we got the Sculptra. We'll use one of the fine line fillers, and I'll hold this for you. So these are very good discussions because this is artistry. There's no 100% right or wrong answer, and it's just a matter of making sure you're communicating well. We went through our ABCs of plastic surgery. There's 4 areas we address to improve the facial appearance. If we sag, we tighten. If we lose volume, we fill. Sun damage to the skin, we can polish and repair the skin. Thank you. We got the rest of them? That's perfect. That's all I need. And of course, we have our pictures here. I'll let you, Charlene, go over on this side. And put everything over there is fine. That's perfect. So, now I'm going to do a cleanse on the skin. If you can just set this over there for now and just leave this one there. That's perfect. Thank you. And I'll need another syringe of local food. So this is the HIBA cleanse. I'm going to have you rest your head all the way back. Thank you, Charlene.
You're welcome.
Everything's looking good.
Everything's going to look better.
The physicians and students that are watching, I cleanse with the HIBA cleanse, and then I cleanse also with alcohol. It's very rare that you get an infection from fillers, but we do the cleansing anyways. Now, when I do the numbing, what I like to do, so I'm going to numb for the lips. So the lips are going to feel big and goofy. That's the numbing medicine, and that goes away. 30 minutes, you'll be fine. So I'm going to lift the lip here. And so go ahead and close your mouth. That's perfect. I call this a modified dental block. It's a labial block, mucosal block. 1, 2, 3, pinch. You feel small, medium, big pinch there. Not too bad. You're doing great. Everything's looking good.
Dr. Rich.
Thank you all for watching. Thank you for sharing.
Dr. Rich, Lola says, loving Dr. Castellano's outfit and his advices to this beautiful lady.
Yes, thank you. We're trying to have fun here. It's always a party in our office, and so try and rise to the occasion and dress for the occasion. And thank you to Alex for being our camera person. Some of my patients were saying, I didn't see so many videos. I took some time off last few weeks, and it was nice to spend time with family. We did a little snowboarding, and that was fun. Thank you, Charlene. Appreciate that. We're wearing our 3M VersaFlow Pampers. Of course, I've had my vaccine, and there's no contraindications for the vaccine and the fillers. We are recommending all of our patients get vaccinated, and I even have my daughter got vaccinated. Now she's excited, got her first dose. So definitely, there's been over 175 million doses given in the United States, and over 700 million worldwide, so it's definitely safer to get the vaccine than it is to get COVID. We are encouraging patients to get the vaccine. Little pinching there. Do you feel small, medium, big pinch?
It's okay.
Does that buzzer help a little bit?
Yes.
The buzz, we use the buzz vibration because it does distract the brain a little bit with the pinching. Okay, and then I do blotting. I promise there's no drooling. Okay, now I'm going to do the same on the lower lip. You feel buzz and then pinch. 1, 2, 3, pinch. Everything's looking good. Thank you for watching. We're on a mission to stop bad plastic surgery. And we're here to show people how to do things the right way. Remember, there are a ton of beginner and intermediate injectors out there, and you just don't know who you're getting. So you got to be conservative. You got to choose the right provider. How you feeling? You doing okay?
You're right about this. I won't be drinking coffee anytime
Yeah, the
soon.
lips feel goofy, but that's going to go away. And there are some people that told me they did their lips and that it was so painful. I'm so sorry for anyone who gets their lips done and it feels painful. It should just feel little tiny pinches, and then you really don't feel what we're doing. Thank goodness for lidocaine. So we talked about the 4 areas: ABCs of plastic surgery, tightening, volume, skin, and behavior. There's 4 rules, the boundaries for good plastic surgery. Safety is always first. You must look natural. We want to prevent future aging changes, and let's get as much improvement as possible. We can't make things perfect. We're not God. We do the best we can. And if we need to come back another day and do more, a little pinch there. It's better than going too far. How are you feeling? You doing okay?
Mm-hmm.
C stands for combination treatments. If we want our best results, we combine tightening, volume, and skin. Best results if you're just doing one treatment is lifting and or laser. Best result, no downtime, is fillers like we're doing today. Now fillers do a great job, but they definitely don't give us a lift. 1, 2, 3, pinch. Lifting, I get wonderful results, but I can do even better when I combine. Little pinch. 1, 2, 3, pinch. 1, 2, 3, pinch. You doing okay?
Yeah, I love that vibrating.
Yeah, the buzz makes a big difference. It's for sure. Let me turn your head this way now. This is that little line that she really wanted addressed. 1, 2, 3, pinch. So we'll fill and plump that as much as possible. We talked about if we want more improvement than what the filler can do, then we're going to be talking about tightening for that area. That's the progression of the conversation. Now, D, you feel pinch, 1, 2, 3, pinch, stands for different perspective. Of course, we never see ourselves, 1, 2, 3, pinch, the same way that other people see us. We look at other people socially, but we do not look at ourselves socially, pinch. We look at ourselves seriously, and we can feel bad about it. If we're too intense about our appearance, that's why people get into trouble. They go too far. They don't have the right doctor to protect them. So we like to talk about it up front to avoid that. So now we're going to be using some of the Restylane, and I'm going to start in the corner of the mouth. You feel a little pinch there?
Mm-hmm.
Small, medium, big? Okay, you'll feel that ease up and go away. There's a little bit of numbing medicine. I mix additional lidocaine in with my fillers, makes them a little less viscous, easier to inject, and makes them more comfortable.
Dr. Rich Martinez says, Ustedes están en Tampa?
En Tampa, al dentro de Villages, tienes de oficina. Llamar a la clínica 813-463-9245 para consultación. Little pinch, 1, 2, 3, pinch. We get the corner of the mouth turned down. The other thing I can do is I can do a little Botox. There's the depressor angulioris, which pulls the corner of the mouth down like this. And so if you relax that muscle, it lifts us up some. So I'm just going to start with this little crease here. This is an intradermal injection. Everything's looking good.
Dr. Rich, Yvette says, I want to do this, but I'm afraid about the needle and the time of recuperation.
There's no recovery. How are you feeling? Are you feeling any pain here?
None. But my lips feel like they're huge.
The lips feel goofy, but that's just the numbing medicine, and that's going to go away,
I know.
okay? So you can already see she's getting a nice improvement in that little crease here. Now, as I tell patients, you don't want to taste the chocolate cake before it's done baking, right? You need to let the result settle down, because even if I don't inject anything and I just put the needle or the cannula, you're going to have some swelling from that.
Mm-hmm.
So we let those areas settle down, and then that's why I like to see patients at around 2 months, and we'll take pictures before and after, put them side by side. We're going to tell you what a great job we did, and then you're going to say, hey, I like it, or you're going to say, you know, I want to add a little more. Or that way you're in control. So this is artistry. There's no 100% right or wrong answer. We'll do this the right way so that you look natural. We're going to keep you safe. We have an outside consulting firm. They monitor all of our practices to make sure we're always raising our standard. Little pinch, 1, 2, 3, pinch. Little pinching there.
Dr. Rich, Yvette also wants to know about the pricing for this treatment.
So you can go to imagelift.com/pricing or give us a call. We give you pricing based on your treatment plan. It's misleading to just say, well, this costs this and this costs that. You need a plan first, because you don't want to price on a treatment plan that doesn't apply to you. Pinch. So give us a call. We'll give you the pricing, or go to imagelift.com/pricing. And you can look at some of the treatment plans and see what that would look like for you. Everything's looking good. How are you feeling?
Fine.
Very good. And Claudia and Charlene have everything set up perfectly. Thank you, Claudia.
Wow, definitely less painful than I've had it other places.
Yes. Well, you get the hang of it after 20,000, so your injector matters. A lot of people out there can inject this stuff, but that doesn't mean that they're any good at it. So now I'm just treating those little creases. Very fine, tiny little injection.
Dr. Carol says, I'm afraid. Can you put me under?
Yeah, we have laughing gas. You can take Valium, but you need a driver. So if you need that, then that's fine. But most people don't want to bother with that. They just want to come in and get their fillers and go. So it's up to you. Do you feel a little pinch there?
Mm-mm.
But if you need laughing gas or if you need Valium, we can give you Valium. That's completely up to you.
But for most people, this is generally just enough.
Yeah, absolutely. So now I'm just chasing those tiny little creases.
And then Intercessora says, how often do you need to do this? How long does it last?
We have permanent fillers. Sculptra lasts 2 to 4 years. And we have the fine line fillers are going to last about a year. So it depends on what you choose. That's why a consultation is so important. So that way you can put a plan together that's right for you, for the longevity, the duration, and the result. The Bellafill permanent fillers are really the most common choice. They're your best value, but I won't use that for fine lines, and I don't use that in the lips, really. So the fine line fillers are more for finishing touches, and they do a great job, but they're only going to last about a year. So it just depends on how good of a result you want. The better the result you want, you may do a little bit more. People are starting earlier. People today, they don't want to wait for advanced aging changes. They want to be proactive. People are living longer, much healthier, they're looking better, and we have better options than ever before. So it's an honor to be a part of our patients' lives, them investing in themselves. I'm going to give you a little bit more gauze, please. So now I'll use about 1/10 of a cc in each corner of the vermilion border. Just enough that it's a tiny bit of plump, but family and friends won't figure it out. I can use the full syringe in the lips, but just to start out, I'll start with half a syringe, and then you can always build if you want to. And it won't be too much. But with the numbing medicine, it'll feel like too much because the lips feel swollen, puff, puff, puff. But that, of course, goes away. Everything's looking good.
Dr. Rich Intercessora is asking, is this Botox?
We're going to do some of the Botox Dysport Xeomin, but this is the hyaluronic acid fine line filler, Restylane, and we're going to be doing a little bit of the Sculptra as well. Everything's looking good.
Dr. Rich, Yvette says thank you for answering her questions.
My pleasure. How are you feeling? You doing okay?
Perfectly.
Thank you all for watching. We're on a mission to stop bad plastic surgery. I guarantee you have family members or friends that are thinking about having a treatment done, so please share this with them. They're going to be upset with you if you tell them you're watching live treatments and then you didn't share, so make sure you're sharing. I am a double board certified facial plastic and reconstructive surgeon. I've done over 4,000 facelifts under local anesthesia, and I've done over 20,000 syringes of filler injection. You get the hang of it after 20,000. And we're honored to be leaders in broadcasting live facial cosmetic treatments. We have our new office coming out soon here in Tampa. Very proud about that. And we have our office up in the Villages, Florida. We have patients coming from out of town, our snowbirds, people from all across the country, even internationally. And thank goodness the world is opening back up. People are getting their vaccines. And we're honored to help lift up this world, one injection at a time, one face at a time. Feel a little bit of a pinch there or not really?
Not really.
You might feel pressure, and if a patient tells me they feel pinching, then I'll do a little more numbing medicine. Everything's looking good. I feel a lot of love in the office every day. My team takes such great care of me, and they'll take great care of you as well. We have our seminars coming up, so make sure you look it up at imagelift.com/events. You can see our seminars, our social distancing seminars. You can do your consult there, learn about your options, meet some of our patients that have had treatments done. So when I only use 1/10 of a cc of hyaluronic acid in the vermilion border in each quadrant, it's very hard to get into trouble. You're just doing a tiny amount. Stay safe, keep patients happy, and if they want to come back for more, they can always do that. Better to do too little than too much. We'll do just enough to get the result. And of course, nothing looks as good as a smile. The smile always looks the best. And you know the power of smile. You're a great smiler. And we're going to finish, once we're done with this, we're going to do some of the Sculptra and then the Botox Dysport Zoom in. So thank you all for watching. Thank you for sharing. And notice when I'm using a 32 gauge needle, it takes a little extra time. And for the hyaluronic acid, I have to put a little extra pressure to get the product through that tiny needle. But you can see there's very little significant bleeding. And she's not feeling any pain. I've done that modified dental block, labial block, regional block. We like to do our follow-ups at around a couple months where we're going to take some pictures at that time, compare before and afters, and we also have our patients follow up with our skincare expert, do some facial masks, chemical peels, and make sure that they're using all the products that they need to be using. Everybody should be on tretinoin. Everybody should be using sunscreen. If you want to treat sunspots and irregular pigmentation, you need to be on lightening creams. So there's a combination of skincare regimen that you can use that's going to be right for you. You need a good skincare coach.
Dr. Rich, Tracy says, love this. What are you wearing on your head?
I am wearing it's called a PAFR, a Powered Air Purified Respirator. And it filters out the air. At some point, I guess we'll graduate our PAFRs and let them go. But for now, we're still using them. Just for everyone's safety until they say, hey, we've got herd immunity. So now I'm just treating fine little touches through here. And that was that especially concerning area on her melolabial fold. Everything's looking good. Thank you for watching. Thank you for sharing. Just little bits, a little drop here, a little drop there. Perfect. The lips look nice and full. Her family and friends are not going to figure it out. Okay, so now I'm going to use a little bit of that Sculptra in just a moment. How's it look so far?
I'm fine. I'm just curious.
Yep. It looks good. You'll pass the grocery store test today. You walk into the grocery, no one does a double take. Of course, we're all wearing masks, so it's easier to pass the grocery store test nowadays. Very good. Perfect. I get text messages from doctors and injectors all the time, people asking me, they say, Dr. Rich, can you mix this one for me, please? They say, can you tell me what's going on with this patient? And I'll give them advice over the phone. Some people I haven't even seen in years, but it pays to have the experienced provider and avoid some of those challenges to begin with by getting your injections done the right way first time around.
Dr. Selena says, just saw this. What are you doing?
You feel a little bit of a pinch there? Not too bad?
No, not at all.
So we're doing some facial filler. We're using Sculptra and fine line filler for around the lips and mouth and the fine lines and wrinkles. So if we're shaking like this is one way, but you want to shake it along the pathway here. So when I'm right here, you're shaking. Usually when you're shaking, just a couple good shakes will get you where you need to be. And so that one's pretty well mixed. I like to mix it right before because the Sculptra can settle. We're going to start on this side here. Because she's had previous treatment under the eyes, we wanted to treat this area. Pressure pinch. It'll feel numb and droopy under the eye in a moment, but a little pinching there. We'll go slowly. We're not in a hurry. How about there? Small, medium, big pinch?
Yeah, that's a big pinch.
That's a bigger pinch, so we'll go slower. How about now? What are you feeling?
Less. I just feel pressure.
Pressure, right. So if you feel the pinch, you feel that little pinch, and then it goes away, and then you feel some pressure. That's why we go slowly, and then she's going to feel very numb. How about here?
Well, like you said, first was a pinch, but then it goes numb.
Good. Now, if you feel lightheaded or anything like that, you let me know. I can lay you back in the chair, okay?
Mm-hmm.
Sometimes people get a vasovagal response where they feel a little lightheaded, and if you lay them back in the chair, they feel comfortable very quickly. It's because the blood flows to the legs and away from the brain, and then sometimes you can feel upset stomach or things like that, but if you lay flat, that feeling, that sensation goes away very quickly. Little pinch there, a little bit. There's numbing medicine in the product that we're injecting. Everything's looking good. Tell me what you're feeling now, pressure or pinch or a little bit of both?
Pressure.
The more I inject, the more numb she's going to feel. So we're not in a hurry, we go slowly. Perfect. So it'll feel a little bit numb and goofy under the eye there. I like to clean the cannula in between injections. So I keep this one here to keep track. Thank you. I'm going to turn your head this way just a little bit. Sculptra is a superior collagen stimulator. Lasts about 2 to 4 years. Feel a little pressure pinch. A little bit of numbing medicine. I like to use the shiver technique to put a very fine amount of filler over a large area. This is very artistic. I gotta wear my Bob Ross jacket. I got one of those. Says he's painting happy little trees. Little pressure pinch, pressure pinch. How about there? Small, medium, big pinch?
Medium.
Pressure pinch, pressure pinch. Alright, that's a bigger pinch, so I'm gonna numb, a little numbing. Let's give a little bit of a break there. And from the previous procedure that she's had at another office, there is a little bit of scar tissue, which is to be expected, so we're just gentle. We do a little more numbing there. How about here? Pressure pinch?
It's okay.
Are you feeling any pinch right now?
Yeah.
Small, medium, big?
It's a small pinch.
So we'll let that numbing settle in a little bit there. How about here? Small, medium, big pinch?
It's okay, yeah.
Are you feeling any pain right now?
No.
So we'll go slowly. Everything is looking good. Thank you all for watching. Thank you for sharing. We're doing some facial fillers with the Sculptra and with the fine lines. We're treating the fine line filler. Turn your head this way just a little bit for me. So here we expect her to feel a little less because she's had some of that numbing medicine. She might feel a little tiny pinch, but it should be less. How about here? What are you feeling?
Not a little tiny pinch. Yeah.
Okay, very good. Pressure pinch. Little pinch. Feel that little bit of that scar tissue there. Everything's looking good. Perfect. With Sculptra, people will either do 1, 2, or 3 sessions. Usually one session you'll see a difference, but sometimes you need that second session before you say, hey, I'm going to really see the result that you're looking for. It's variable. Because remember, this is artistry. We can't make things perfect. You just make some improvement. Make sure that you're looking natural. Make sure you choose the right artist to take care of you, and do not, this is not a beginning. There's a little pinch there.
Yeah.
This is not a beginner maneuver. This is more advanced technique. I like to do that 5-minute massage 5 times a day for 5 days. Very good. Everything is looking good. I'm very happy with what I see.
Good.
Pressure pinch. You feel a little pressure pinch there or not really?
Not on that side as much as the other side I felt.
There's a little bit more scar tissue from your previous treatment, so I can certainly work with that. Everything's looking good. Sculptra is gradual. You need about 3 to 6 weeks to start to see an effect. And then even at 2 months, 4 months, at 6 months, little pinching here, you'll see continued improvement. Pressure pinch, pressure pinch. Perfect. Very good. Okay, I'm going to do a little touch in the brow.
That's what I found most interesting about the video I saw, is what you did for her upper brow.
Yeah, the brow is important because the brow drops. Let me turn your head this way. As we get older, and you need to pay attention to the volume in the brow. Pressure pinch, pressure pinch. A little bit of numbing medicine there. Perfect. Volumizing is so important. If you want to know how important volume is, go look at your high school yearbook or pictures of yourself in your 20s, and you'll see how that volume changes. And all I'm doing is putting back what was there, because it's very natural that we lose skin, that we lose muscle, and we lose a little bit of the fat. We also lose bone. How are you feeling? You doing okay?
Yep, fine.
You're tough. Pressure pinch, pressure pinch. So we're just paying attention to what the anatomy shows us, and patients a lot of times will come in and bring their younger pictures. I don't need to see them, but it's helpful in the discussion so that patients can understand, yes, I really do see all of the difference in my facial volume, and it's just as simple as putting back what was there. That's what gives you the most natural looking appearance. Everything's looking good. Okay, so I'm still injecting more, but let me show you what we've done so far. Why don't you open up your eyes? So can you see how it builds up this area?
Oh, wow.
Yep. And how do the lips look so far?
You're right, nobody's going to tell.
But you can see there's a little plumping. So what I'm going to do now is I'm going to focus around the crease lines in through here. Okay, make a big smile for me, a big smile. So it looks natural, it's not overdone. Okay, is that okay if I just keep working on the, around the smile line? Some
Did you
people say,
already put volume here?
I put some there, but you want to make sure you don't put too much. Sometimes I'll do a second session, but we do one. If you put too much, you don't want to feel a bump there.
It looks great. I mean, I'm like,
yeah, I did put
I
a
thought
little
you were
across
just
there.
putting,
And I'm going to put some of the Botox Dysport Xeomin in the forehead and crow's feet.
oh, I thought you were just putting numbing there.
Yeah, I put a little bit of the product there too.
Oh, it looks great.
I'm glad you like it. So now I'm going to focus around the mouth, one step at a time. And we treated some of the little creases, so we'll wait for the water has to absorb. I can't take away 100%. If you want more improvement in the fine lines than what the fine line filler can achieve, then you'll be talking about laser resurfacing. Okay.
Oh, looks fine.
Glad you like it. I'm going to use a little bit of the local anesthesia. Now, do you feel a little bit of a pinch here? Not too bad? Small, medium, big? Little pinch here?
Small. Nothing intolerable, certainly.
1, 2, 3, pinch. Pinch. So we can strengthen the jawline by just putting a little bit of volume through here. And even though we lose the volume of the premaxillary space, the vertical maxillary buttress, we're just putting back that volume here. Very good. I like to mix the Sculptra immediately before I inject it because it can settle a little bit. Little pressure pinch. And now I'm just strengthening the jawline. This is the pre-jowl sulcus. Little pinch there. Doing okay?
Mm-hmm.
Everything's looking good. The shape of the jawline is very important to contour. And you can see how it's a little sharper here, but a little more full through here. So just that one little syringe makes a difference with the Sculptra. We'll do some on the other side as well. So that's called the pre-jowl sulcus. I'm going to turn your head this way just a little bit. Pressure pinch, a little pinching there. There we go. And then this is subcutaneous, and then I'm going right to superficial across the mandible. Back and forth, just putting a small amount of product over a large area. I like to recommend that 5-minute massage 5 times a day for 5 days. Everything's looking good. Perfect. We doing okay?
Absolutely.
If you need a break, you let me know. I'm not in a hurry. I always tell patients that, right? It's very uncommon that they will say, hey, I need a break. But if they need a break, we give them a break.
No, but this is fantastic. I can see.
You can see the results straight away.
Yeah. Yeah.
Rest your head all the way back. So building up this volume, little pinching there, sorry. And the lip will feel a little numb from this type of injection, and that's normal. Let patients know, because they'll ask you, they say, is it normal that my lip feels numb? Not everybody feels it, but a lot of people do. Doing okay?
Yep.
Little pressure, little pinch there. Building up the premaxillary space and the vertical maxillary buttress. We do lose volume there because we're losing bony volume. It changes the shape of our face, makes us look older. If you put that volume back, magically it makes us look younger. Everything's looking good. Thank you for watching and thank you for sharing. If you're just now joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon here in Tampa and in the Villages, Florida. Patients will tell me that they like watching our videos because they say your patients are happy, they don't look crazy, right? And, you know, because nobody wants to look like they've been overdone or too much, so this is the right way to do things. We're on a mission to stop bad plastic surgery, and when people are not going to make good choices until they know their options. That's why we're here to share these videos. And we have people all over the world watching our videos. It's an honor to be a leader in patient education with live videos. There's no substitute for seeing what is the latest, what is working today, what are people doing, and what are they happy with, what's keeping them looking natural, and what's keeping them safe. You're going to see all that here. Very good. A little bit more, then we're done. So I'll finish up with the fine line filler. I like to use the hyaluronic acid is going to give you a little bit more of an immediate result. No restrictions afterwards. You feel a little pinching here or not really?
Well, it's very
Pressure?
little, but it's not anything bad. It's not intolerable by any means.
Very good. Okay, so we're done with the filler. Now we're going to use the Wrinkle Relaxer, Botox, Dysport, Zoom In, Jeuveau, Nutox.
Geez, this is amazing.
I'm glad you like it. Put your head all the way back. So we're going to do a little bit of the crow's feet wrinkle relaxer. 1, 2, 3, pinch. 1, 2. There's a little pressure there. 1, 2, 3, pinch. 1, 2, 3, pinch. Pinch. 1, 2, 3, pinch. Claudia, can you come help me and just hold a little pressure for me? Right, can you walk on the front? You need to walk on this side, thank you. And right on that side. Thank you very much. Turn your head this way just a little bit. Buzz and pinch. 1, 2, 3, pinch. 1, 2, 3, pinch. Sorry, pinch. Pinch. And pinch. Doing okay?
Yeah, those pinches are the worst, but they're
Yeah,
not
the little
bad.
Botox pinches sometimes can be the worst. Some people use numbing creams, but I don't think the numbing creams really make much difference because they're superficial. Raise your eyebrows up real high for me. Now it's maybe, there you go. Now relax as best you can. So buzz and pinch. 1, 2, 3, pinch. 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 Continue before that's good. 1, 2, 3, pinch. 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 I like to ask patients give it 2 weeks for the Botox Dysport Zoom In to settle in. Pinch. Pinch. And if you need more, you can always add more. Raise your eyebrows up real high again. Now relax as best you can. 1, 2, 3, pinch. 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 Okay, we're completely done. Hopefully that wasn't too bad. And release on that fine. Yeah, very good. You did great. So let's take a look in the mirror together. You'll pass the grocery store test today. You walk into the grocery. Nobody does a double take. Let's get you cleaned up. And we got a big improvement with that little crease. Now, the swelling's going to settle. So that crease doesn't go away 100%, but it's going to be a lot better.
Yes.
And that's why at 2 months we're going to take pictures. But if you look from the before pictures, and you see how deep the crease was there, it's quite, and how deep this valley is on both sides. And now we've got a smoother contour here, and come take a look on this side. So you can really see more smoothness here, a lot more smooth from this little crease. And the cheeks are also a little more full, and a little bit in the brow. You can see she has this little extra skin, but that fills in very nicely because of the filler. So congratulations, no restrictions. So here's your homework. 5-minute massage, 5 times a day for 5 days. You cannot hurt the product. You won't bother it. If you feel a bump, you massage on that area. It'll settle down. We'll see you in 2 months. Any questions?
The massage, is it out? Is
Let me
it
show you.
in?
So it's up, down, side to side, back and forth, across your brow, across your smile lines, and down around the mouth.
So there isn't any direction to go in, it's just touching it. Okay, I can do that. But man, this is amazing.
I'm glad you like it.
That is
We'll
amazing.
see you in 2 months. I give you the hugs and hugs and hugs.
This feels
Hugs
weird.
for you too. Thank you for watching. We're on a mission to stop bad plastic surgery. We're here to help you raise your cosmetic standards and do things the right way. I'm Dr. Rich Castellano. I'll see you in the next video. Congratulations. It really looks good. Thank you, Alex. Thank you, Claudia.